Wheelan Presley Funeral Home and Crematory, a proud supporter of WQPT, has been serving Quad City families since 1889. They now have live stream capabilities for viewing your loved one's funeral or memorial service.
Children over the age of 12 can now get the COVID-19 vaccine, but what should parents do and the other concerns they may have for their kids? Plus, a world of color has found its home in the cities. The Centers for Disease Control and Prevention now says anyone 12 and older can and should get a COVID-19 vaccination. It's another milestone on this 15-month march through the start, the worst, and now the easing of the COVID pandemic. But parents may rightly have some concerns. The FDA says its tests on children found no adverse effects. And the Scott County Health Department's medical director, Dr. Lewis Katz, says he wants to see children immunized yesterday. Well, we talked with Rock Island County Health Department's Janet Hill about the effort now to get children their shot. This is a big step to allow 12-year-olds and everyone older now to get the Pfizer vaccine.
Yes, it is. We're so excited about being able to do 12-year-olds. We need to get as many people as possible vaccinated so we can get close to having herd immunity, and just getting this group. These kids have had a particularly tough time. I mean, just think about being a young teenager and your life revolves around your friends in school, and that's been taken away from them for the last 14 months. So we're really, really happy to be able to give this back to them.
I have heard from parents, a lot of people waited. As far as the adults are concerned, I'm going to let other people go first. I'm going to wait a while before deciding getting the vaccine. You're hearing that even more with parents who are more worried about their children. Let's wait and see.
Well, the studies have been really successful. More than 1,000 kids were vaccinated. Not a single one had a serious side effect, and not a single one got COVID. And that's really clear to me that that this vaccine is shown to be effective in everyone 12 and older.
Has it shown to be equally effective for adults? I mean, we've talked about some adults that have gotten sick from some of the vaccines, but millions of doses have been administered.
That's right. There's been a handful of breakthrough cases where people have gotten sick after getting vaccinated, but that is to be expected. The vaccines are not 100% effective. They are 90 to 95% effective. And so that means that some people may just be the unlucky ones who still get a case of COVID. That seems to be a lesser case. They may not be suffering as much after vaccination.
Some parents might say, look, kids might get COVID, but they don't get that sick from it. Why should they get the vaccine?
So getting the vaccine protects you, but it also protects your family and your community. So the kids may not get as sick, but they could possibly get someone else who is not vaccinated sick. And sometimes the kids do get, it's rare, but they could get a serious condition called multi-inflammatory syndrome, and that is really dangerous. So if we can get these kids vaccinated, it protects them, and it protects their family, and it protects their community.
On the other end of the scale, you do have seniors, and more than 70% of seniors in Rock Island County, I believe was the last statistic, have already been administered all the doses and are fully vaccinated. Is your job done there?
I think we have another 30% we'd like to get vaccinated. And, the closer we get to getting everyone vaccinated, the safer all of us are. And have seen consistently through the pandemic that our older residents are the ones who get very sick and the ones who are more likely to die.
But the 70% is a pretty good number, right?
That is a really good number. We're very happy about that. I'd sure like to see it 10 to 15% higher, though.
What about all adults? I mean, from 18 over, to the best of my knowledge, you're still a little under 50% right now.
That's right. And, the CDC has said that they don't believe that we're going to reach herd immunity. I think that we should still try. We can make the Quad Cities a safer area than maybe perhaps it is nationally. But that's going to take everyone to do their part and get this vaccine that has been shown to be highly effective and very safe.
We have seen this week where the government, perhaps surprising a number of people, changing its mask mandates, really easing on the COVID restrictions. Is that something the local health departments are applauding?
No, I can say that, the scientific message is clear. If you're vaccinated, you can safely do so much more. And if you are vaccinated, fully vaccinated, what that means is 2 doses if it's a 2-dose series, and 2 weeks after that, or if it's the 1-dose vaccine, 2 weeks after that 1 dose, then you can do more things. You don't necessarily have to wear a mask in private or public, and to be absolutely safe, because you don't know that who is around you, who is vaccinated. You can choose to continue to wear a mask.
As you know, Scott County Health Department's medical director, Dr. Lewis Katz, was saying that one of the other big developments from this past week was the federal government saying that children can get not only the COVID vaccine, but the other vaccines that they need at the same time. How big a deal is that?
That is a really big deal for us. Throughout the pandemic, we've been seeing children's vaccination rates fall for just routine vaccinations. And that's a little bit scary to us because, we need to avoid outbreaks of the other vaccine preventable diseases. And parents should keep up with those well child visits. So we urge them to make their appointments to get not only their COVID vaccine, but to make sure that they're up to date on all their other ones too.
The other thing that Dr. Katz was pointing out is that there's a lot of question about children younger than 12 getting the COVID vaccine, and that tests are continuing in a number of locations, and he was anticipating some kind of announcement either late summer or early fall.
That would be wonderful. I know that the studies are going down to children as young as 6 months at this point, and the vaccine has been proven to be effective for 12 and older, and I have every hope that it'll be good for kids who are younger than that. I mean, to reach that herd immunity or close to that herd immunity, we need to have kids vaccinated. And like I said, it's not just about the child getting sick, who may get a more mild case, but what if that child is sick and is around another child who has not been vaccinated, and that child gets that MIS that I talked about, or a grandparent who hasn't had a chance to get vaccinated. Just going back to taking care of your community, and that's what this mass vaccination effort really is. It's about taking care of your community.
Well, and I was going to say we've talked about people who are not believers in vaccinations, and there is going to be a certain level of the population that's not going to get vaccinated. Children won't get vaccinated. Unless you've got a scarlet letter or a tattoo on your forehead, we really won't know who's vaccinated and who's not. When you talk about herd immunity, you're coming up with statistics, but you can't really tell in public if those 7 people and those 3 have and have not.
That's right. And that's why we just are urging people, if they feel safer to wear a mask, that they continue to do that. If they need to social distance for their own mental health, continue to do that. We are not going to make people get vaccinated. We are just relying on the honor system and their good intentions to take care of their community.
We heard from Dr. Kandula, a pediatrician, earlier this week talking about the mental health of children, that she has talked, obviously she sees kids day in and day out, and she is concerned that there has been a growing mental health issue for our children, mostly due to isolation, but also the fact that they're not really around their friends and the normalcy that provides.
And that's one of the most exciting things about this announcement is, 2 weeks after being fully vaccinated, kids can go back to having sleepovers. They can play on sports teams without worry. They can go on a family vacation. They can hang out with their friends. And I know these kids have been suffering, throughout this. And, hanging out with your friends on FaceTime is not the same as hanging out with your friends in your living room. And getting vaccinated will bring that opportunity back to all of our kids who really need that boost for their mental health.
We're seeing vaccinations now being distributed among some doctors' offices. I believe that's being allowed in Illinois in the coming weeks. We know that drugstores like CVS and places like Walmart and Walgreens are offering them. How long will the Camden Center actually be in operation?
It'll be through the end of May. The state is making a switch from these mass vaccination sites to more targeted approaches. The pharmacies will still get the plenty of vaccine, and there are many appointments available. Some of them are even offering walk-in. Our healthcare partners are starting to get it into the physician's office. We're hoping that if people might be a little bit hesitant to go to a more public site, that they may have that conversation with their physician and be convinced that the vaccine is a good option for them, and they can do that in the privacy of their physician's offices. So, while the large vaccination sites may not be as prevalent, the vaccine is still widely available.
Because we are seeing more vaccination clinics even in churches or small community centers. Mm-hmm. Are you thinking, and I hate to say this, but is Rock Island County thinking of actually making it almost like, when you're talking about mobile vaccination clinic, almost like a food truck driving around that's making the shots available to people?
We have been doing a couple of pop-up clinics and very targeted approaches. We are going to offer vaccination here at the health department 1 or 2 times a week. Watch for more information on that. We've gone to a couple of churches. We're going to go to St. Mary's in the Floreciente neighborhood in Moline coming up here next week. There are ample opportunities for people, and we're trying to bring it to places where people are most comfortable in getting it. A lot of our communities of color, is a lot of vaccine hesitancy. So we believe if we can bring it to those communities where they go every single week or every single day and are very comfortable, that they may be more comfortable in getting the vaccine. So far we've done Mount Zion Church in East Moline. We did Second Baptist in Rock Island, and then we have St. Mary's in Moline coming up. Because
you really are now targeting, as you said, people of color and people who are hesitant for more than just the fear of the vaccine, but are hesitant just to go to public places.
That's right. I mean, the Camden Center, for example, we do a lot of social distancing. Masks are required, and they still will be required going forward. This is a healthcare facility, and the people, by the very nature of the site, are not vaccinated when they come there. So, we just need to make it as easy as possible. And by having our healthcare partners and our pharmacy partners also pitching in to help. This is not just a public health effort. This is an entire public health and healthcare community effort to get our community as safe as possible.
It has been 15 months, that is, of COVID. And I think Health Department, you guys have lived and breathed and slept all regarding COVID-19. And I know that there's light at the end of the tunnel and that somehow this will be in the rearview mirror. Is that something you're thinking about now, or do you think, wow, we still have so much more work to do? We're getting to the point where we can start to think about, taking some days off. People here at the health department are scheduling some summer vacations and, making sure that they have some time for themselves. It has been a long 14, 15 months for us. And, your health departments have been working, 6 and 7 days a week. And as have many of our healthcare partners, they're working long shifts. Think back to, during those surges where the nurses and physicians and medical assistants and CNAs, they were, very much working beyond capacity. And, we need to get people vaccinated so we don't ever go back to a situation like that. I remember talking to Dr. Katz, the infectious disease specialist in the Quad Cities, I think as early as late April of last year. And he's talking about, how bad it could get. And I'm sitting there thinking, yeah, it'll probably get bad around Memorial Day and then get better during the summer, and it's not going to be that big of a deal. Were you surprised at the scope of this pandemic as well, and how society adapted or even pushed back against it? Because there will be future pandemics. There will be, future health emergencies. You now can write a book on how to handle them.
At the end of last May, I remember putting out a media release where we had 0 cases. And that was like, oh, we can take a breath now. And then cases started inching up a little bit after Memorial Day, and then a little bit after 4th of July. And then by the late summer, early fall, we were just at a level that we probably could not have predicted. I mean, the fact that we have more than 14,000 cases in Rock Island County and Scott County has more than 20,000, I mean, that is a very significant proportion of our population. And while thankfully, we have a little more than 500 deaths, 500 to 600 deaths in the Quad Cities, that doesn't take into account just the amount of suffering that people went through, the amount of healthcare resources that were burned through. People want to just get on with life, but the pandemic is not completely over yet. There is a light, but to get there, we need to get people vaccinated.
Janet Hill, Chief Operating Officer for the Rock Island County Health Department. In a moment, an amazing new exhibit and a new permanent place to put it in the Putnam Museum. But first, Laura Adams is one of the happiest people around as many COVID restrictions are now eased and people can once again go out and about.
This is Out and About through June 3rd. The free Illinois Elks Children's Orthopedic Clinic takes place May 18th from 2:30 to 4:30 at ORA Orthopedics in Moline. Beehive, the 60s musical, is a fun flashback to the fabulous females who left their mark on 1960s pop music, opening at Circa 21, while the newly restored Forest Grove School No. 5 is now open for tours, Saturdays through October 30th. The third annual Earth Day Fair is coming to the Freight House Farmers Market the 22nd from 9 to 2, or Shop with Hops, where you can sip, sample, and shop your way through LeClaire, Iowa, starting at 3 on May 22nd. Tipton, Iowa hosts the Good Makers Market May 28th and 29th, featuring the best hand-picked vendors in the Midwest at the Cedar County Fairgrounds. Plus, Ballet Quad Cities and the Quad City Symphony Orchestra's Trio will headline a performance at the Adler Theater May 29th at 8. Fleet Feet Davenport brings runners to the TBK Bank Sports Complex on the 31st at 7 for a variety of races. Be sure to register and run Memorial Day weekend. Stolen Set Improv at the Spotlight Theater is a family-friendly improv show happening the 22nd at 7, while comedy returns to the Black Box Theater on the 22nd at 7:30 with improvisation from It's Your Fault and Guys and Ties. For more information, visit wqpt.org.
Thanks, Laura. Musician Lojo Russo says performing is her passion. She says it's a long, strange, wonderful trip of promise and adventure. Now, with many music venues still somewhat shut down, she and so many entertainers have been on a forced hiatus. But she was kind enough to join us at Moline's Black Box Theater before the pandemic to give us a performance of some of her original works. Here's Lojo Russo with Restless Soul.
There's a sign down on Main Street, attracts me like a moth to a flame. Illuminating words, saying thank you, please come back again. It reminds my restless soul, I've been here too long, without a word or a whisper. Going, going, gone. There's a girl back in Boston, remembers better me. When I took everything for granted, gave it all away for free. It reminds me of a time when I thought I could do no wrong, and like a fading photograph, it's going, going, gone. I am tired of running, all the lies that I've sold. Comes a time and a place when you stand face to face with the weight of it all. Your heart hits a wall. to the story no one has ever heard. It's the side that's the truth, and the side where no one gets hurt. I'm reminded that history is written by those who are strong, and like pages torn and tattered, going, going, gone. I'm gone. I'm tired of running from all my faults and regrets. Comes a time and a place when you stand face to face with the weight of it all. Your heart hits a wall. There's a sign up ahead telling me it's time to come home.
Lo-Joe Russo with Restless Soul, recorded at Moline's Black Box Theater. The Putnam Museum is making the most of some of its biggest benefactors. Think of the names: Figge, Palmer, even Putnam itself. They are Davenport families who grew prosperous and also grew amazing collections of art and treasures. Now some of those treasures can be seen at the Putnam. We talked with Putnam President Rachel Mullins about an exciting new exhibit and exhibit space. The Putnam is actually getting bigger, especially with exhibit space, bigger than some people might think.
Yeah. And we actually, by the end of this month, we will be fully reopened, the entire facility, with the opening of our giant screen theater, reopening for the first time in 14 months this weekend with a new film. And then we have a new gallery opening on May 22nd and 23rd to the public, and we'll be fully reopened.
Well, let's talk about that new gallery. It's the World Culture Gallery. It is permanent. It is new space in the Putnam, and you're opening with something pretty colorful.
That's right. Yes. So people that are familiar with the Putnam will know about the Unearthing Ancient Egypt exhibit. It's a big favorite for families and school groups. And just outside of that space, we've actually created a new gallery that will feature our world culture collection. So it's objects from around the globe, but also feature the cultures right here in the Quad Cities area. Over time, we've really grown our international community, and this gallery will feature not only our world traveler founders and some of their collection, but contemporary issues for our international community.
And that's what you really, I mean, you're starting with a bang. It's the colors of culture, and you're really digging into the treasures of some of the most prominent citizens in the Quad Cities.
Yes, so we'll be featuring objects from the Palmer estate and the Figge family from our collection at the Putnam. And then we're partnering with World Relief Quad Cities with objects loaned from our newest Quad Citians from their refugee resettlement program. So we have some of the refugee families that are actually participating in the exhibit, and they've loaned objects and clothing and some household items for the exhibit, all that celebrate the various colors and what color means in different cultures.
This exhibit is opening, it's kind of a new part of the Putnam at a time when the world is reopening, the Quad Cities is reopening. And you had that last 15 months of COVID restrictions, and like you said, I mean, you had a construction project and you were updating. It was almost kind of, I don't want to say it was a blessing, but it gave you a chance, an opportunity to make some changes. Explain to me what this means now. And I know you're dealing with a cat, But
Sorry.
no, you're fine. Explain to me what the opening and the easing of COVID restrictions mean.
So we are still maintaining face coverings at the Putnam. As a science center, we've really been tracking the case counts and the vaccine distribution in our community. So the news from the CDC this week was so encouraging. We're really excited. And we're going to be reviewing those restrictions. We've started lifting some of our group size restrictions and some of the caps that we've had in place on ticketing and maximum group size in the different galleries. So we're already starting to see not only the community, but some of our galleries and Putnam programs starting to allow larger group size. So we'll be reviewing over the next several weeks and kind of keeping an eye on the case counts here locally. And yeah, it's a wonderful time in the community we're starting to see some of these events coming back. And it's great that it's heading into the summer so that we can really focus on some of the outdoor activities as well during this time period, just to be cautious.
Well, and the Putnam does offer programs for children and families during the summer. That was all but abandoned last summer. What are your plans for this summer?
Yeah, our group size last summer was down to 10 kids. We've expanded that a little bit, so our summer camps are back, but we're still kind of small group, serving a group of 15 students for the summer camp programs. But we're also seeing some of those large events back. In fact, the end of this month on May 29th, we'll have our Pollinator Palooza back at the Putnam. It's a very popular event in partnership with the Master Gardeners program at ISU Extension. Big plant sale, and we'll be featuring a Flight of the Butterflies in the theater.
Which you have talked about before. I mean, you've done issues on pollinators for a while, in fact. Is it going to be nice? Because the Putnam Museum is always kind of neat to hear the echo of the sound of children. and it's been kind of a little silenced over the last 15 months.
Yeah, we're starting to see our families back at the Putnam. In fact, our weekend attendance is starting to rival where we were before we were required to close last spring.
That's great.
So truly, our families are ready to get back out. What I'm hearing 201 from families and our school groups that are starting to come back is that kids don't want to be in front of the screen anymore. They're ready for that hands-on learning that the Putnam is known for.
Putnam President Rachel Mullins, on the air, on the radio, on the web, on your mobile device, and streaming on your computer. Thanks for taking some time to join us as we talk about the issues on the cities.
Whelan Presley Funeral Home and Crematory, a proud supporter of WQPT, has been serving Quad City families since 1889. They now have live stream capabilities for viewing your loved one's funeral or memorial service.